Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, Anita Finley.
You've heard him before, of course, and this is Dr. William Leone, and he is the head of the Lyon Center for Orthopedic Care at Holy Cross Hospital. He specializes in partial and total hip and knee replacement and revision surgery and knee arthroscopy. And I have to always put a personal plug in here because my husband's knees and his hips are doing great, and his hips could have been a major problem, but he's not in a wheelchair. He walks as fast as he can. Right now he's probably walking my dog. And I have to thank Dr. Leone because it was your great artistry and caring that got him where he is. And we do thank you day after day after day. We should put a plaque up in our wall now for you, Dr. Leone.
Thank you. It's my privilege, and it's always my privilege to be back here. Thank you for inviting me.
Yeah, it's great, Dr. Leone. And so your article in this issue now, everyone probably has their January issue, is why joint replacement patients are getting well so much faster today. Is that true?
It's, when I reflect back on my career, which is, now 26 years, I think that's one of the things that's the most different, the most pungent. And it's for so many good reasons. Better technique, much better handling of postoperative care, postoperative pain by preempting it, better anesthetic drugs and a lot more regional anesthetic. And a lot of it is patient education. When people go into a situation really with a plan and knowing what to expect, it's a lot less scary and they have a better experience. So a lot of really good reasons. And our techniques are better, like you'd hope they would be after 25 years.
Well, but you've been through this, and you were always on the cutting edge, though, even though yes, things were different, but you've always sought out the best and always took your time, and you've been an inventor yourself because it just wasn't working the way you wanted it to work.
What I do now is only because I stand on the shoulders of so many just brilliant, creative people that took a chance before me. So when you do an awful lot of one thing, which is what I really get to do, you see nuances and you see how you can make small incremental changes. But when you begin to add up those over the years and then you look back, you say, goodness, it's a very different procedure. And look how much better people are really doing, and we can quantitate that. We can demonstrate that. And more importantly, people feel that. They know that. It's all good. It's really going in the right directions. We've had some missteps. Actually, what I was thinking we could talk about this morning is, how someone who's not in the medical field kind of sorts through all the noise that's out there when they have to make a decision for themselves or someone they really care about, because there's so much out there. And it's not easy. It's a blessing because there is so much information. It's not like the old days where you saw your doctor and he told you what he was going to do and you said, yes, doctor, and you did it. But on the other hand, so much of the information is unfiltered and maybe not accurate. So
give us some tips. So someone's out there now in pain. They've been putting it off. They want to get their knees hit or hips done. Tell us what they should do.
Well, you really need to understand where the pain's coming from. You need to find the root cause. You need to really have it defined. People, will be treating something and seeing their chiropractic physician or seeing their therapist or taking their health pills. But where is it really generating from? And then once it's defined, then you can create a treatment plan, if you will, to try to address really what's causing the pain. Where is it coming from? How do you really treat not just the symptom, but what's caused it?
But excuse me. So if someone has a knee pain, isn't it in the knee?
Frequently it is in the knee, but sometimes it's not in the knee. It's extra articular, something on the outside of the knee. Or maybe it's not in the knee. Maybe it's actually in the hip, which is quite common because some of the nerves that innervate the hip innervate the knee. And when the hip is then actually the problem, those nerves are stimulated and the brain can get confused just where on the nerve the pain's coming from. It's called referred pain. And the low back is, of course, the classic and frequent masquerade. And so you need to go back to the basics. It's so much of this is finding an individual who will take interest and who will sit and really find out what's going on. Have a conversation. What causes the symptoms? Is this all the time or just sometimes? Are these mechanical symptoms where you find and suddenly it gives way, or is this something that, or it's hard to get out of a chair or hard to get out of the car, or is this you're fine and suddenly it comes on? So you really need to have someone who's interested and knowledgeable, who will in an old-fashioned way take a real history and then do a real physical exam. I mean, that's a lost art, unfortunately, in our world, because we have so many tests. You don't jump to an MRI scan. You jump to an exam and good plain x-rays. And then once you know what you're dealing with and you've defined it, this is a knee thing, this is an arthritic knee, this is a torn meniscus in a knee, this is an unstable knee, this is a hip, this is a torn labrum, this is a hip fracture, this is actually a pelvic problem. No, this is coming from the back. Then you can begin saying, okay, what's the next step? What's our menu here? And if we do this menu, how long do we go at it this way before we need to change plans? We need to change course. But no, you have to, in a very human way and in a very involved way, still be scientific and still say, okay, this is the thought process. This is the tree that we need to follow to ultimately resolve it. That's our goal.
Well, this is excellent. So now the question is, how do you know who to go to? I would, of course, recommend you, but how do you then know? You said noise of the information. How about noise of all the doctors?
Yeah.
How do you know?
Well,
what questions should they ask?
It's not just the doctor, but honestly, when people come to me, informed, and it's wonderful now because my best patients are my informed patients, and people that get to me are informed. They've done their, quote, research, and almost invariably that's on the web. And there's a lot of great stuff on the web. And then, of course, there's a lot of unfiltered stuff on the web that just isn't real, isn't true, and it's biased. But, everything has a bias. I understand that. And so as you go through it, you need to have that in mind. You need to be educated. You need to be somewhat cynical and be thinking, okay, I've seen it in several places. I think talking to people, when you start hearing the same name over and over from very different sources, that's confirmatory and it feels good.
So I have to tell you something, and I think I may have written this to you, but I had, and I don't think he would mind if I told you this, but he is the, and I won't tell you his name. I won't tell people his name particularly, but he's in a very high position in Broward Health, and he is the medical head of medicine for Broward Health with all their hospitals. And they have a lot of orthopedic surgeons there. Anyway, he was on my radio show, and he told me that he's going in for, I think it was hip surgery or knee. Knee. Okay. And I said, so what are you doing? He said, well, of course I'm going to Bill Leone. And I told him about my husband, Bill. And he said, he's the best. And so I think I probably wrote you because that was quite a thing to have him. I don't think he did it on radio, but I'm doing it, so I'm bad. But I had to tell you now that's what you're talking about. When you get someone of that, that he's so smart. He's been in the medical business practice for so long. And I guess he was a pulmonologist years ago. But I mean, I was so proud to hear him say that.
Well, thank you. I'm very, very fortunate that I really touch a lot of equals and contemporaries and really cool people. I
mean, he's not going to Broward Health; he's going to the Holy Cross.
Well, when it comes,
it's you, though.
When people come to me and they want to know which prosthetic I'm going to put in, and they want to know what approach I'm going to use, and they want to know, the reality is there's a million little decisions that go into baking this pie and having not just a good result, but a really good experience. And without question, and there's billboards and there's ads and there's this and there's that, the most important decision anyone makes, that important decision is actually that one individual who really takes on the responsibility, who takes it very personal, and does the surgery. And the rest of it is important, but that trumps it all. And I think when, at least, I'm sensitive, and I read people, and I think we all do to some degree, some more than others. And I think if you begin running into a brick wall as soon as you're dealing with the office, and you're not really feeling the help, someone helping you through the system, you're feeling alienated, you're feeling angry, you're frustrated, your time isn't being respected, all these things we've all experienced. I think you need to step back and say, goodness, should it be like this? Does it have to be like this? Do I have alternatives? And I encourage people to get other opinions. I mean, what I do is really specialized. I'm not a general doctor. And so, no, goodness, you need to go through the conservative stuff. You need at the end of the day to feel in your own heart that if you go forward with this, it's the right thing to do. You're capitulating, not because you're giving up, because you've tried these other things and you need to get on with your life. And we all reach that point at a different point, but there is a point, and it's appropriate. It's life changing.
And Dr. Leone, I have to say that you've heard this before. Well, this is a brilliant doctor. He just doesn't have any bedside manner. And that's a terrible thing, because I don't know who made him so brilliant, but that's what you were talking about, that you do take the time. You do care. People know that. They see it in your eyes. I don't know why someone like that, who maybe is an excellent physician, can't do the things you said. How can they be an excellent physician if they don't know the person and take the time with them?
I think it's easy to be an excellent physician when everything goes well. But if you've been doing this for as long as I've now been doing this, and if you agree to take care of the cases, the people that I've cared for with problems that no one will take care for, all the failures, all the revisions, all the infections, all the congenital weird stuff, and so my career, I've really gotten good because I've done all of these cases and made a career out of it. Then it's really those cases that separate you, because it's how you take care of the complications. You can't do an awful lot of cases and not have things go wrong, because we're dealing with human nature and with machines, not with machines, with people. And so, and that's when you really see the difference. What happens when things don't go well? How do you dig in and turn a really bad result into something that's good? And I had a great physician, a mentor, teach me early on in my career. I was a resident. It was Gordy Hill. I was coming up as a resident and spending some time with him. And he said, you're going to know you made it when your biggest complications become your successes and they send you their friends.
Touche, yes.
And that is not just in medicine. I'm sure that's in everything. In law and in business. And if you really are out there, doing the next step and not pushing, but building, and you're restless and you're searching for that next thing. And of course, in my field, it's what I do. It's medicine, but you could extrapolate this into many other areas. Things will go wrong, but it's then how do you not just recover, but how do you learn from it? And then how do you really make it right? How do you make it better because of it?
So let's get into the nitty gritty. Let me tell everybody again, this brilliant physician we're talking about, orthopedic surgeon, is Dr. William Leone. I'll do this officially. Dr. William A. Leone, Jr., and he's head of the Lyon Center for the Orthopedic Care at Holy Cross Hospital, and specializes in partial and total hip and knee replacement and revision surgery and knee arthroscopy. And let me just say that the Lyon Center is located at the Holy Cross Healthplex, which is over there in Fort Lauderdale on Northeast 56th Street. This is Pencil Radio. Get your phone number right now. Write it down. And if you are suffering from any of these orthopedic problems, please do call him. His number is 954-489-4575. Again, that's 954-489-4575. Or you can go on the web and go to holycrosslyoncenter.com. holycrosslyoncenter.com. When you know that you've examined someone and you know it's going to be one of the tougher cases, do you, like a puzzle, do you sit there for a while after, before you have the operation and design it in your head and what you're going to do? Tell me what a doctor like you does. I just don't really know.
I'm actually, I'm very disciplined and I'm very organized. And that's, I think, been a big key to me being able to take care of so many people and make it look graceful because, and do a lot in one day because, I do my homework. And part of that is going into the OR, really prepared. It's really making sure that someone doesn't get to the hospital and we have to say, no, you have to go home now because we don't have a this or a chest x-ray or a lab. Oh my goodness, yes. Okay. And they know what time to be there and they know what to expect. And they know I'm going to sign their leg and I'm going to shake their hand and I'm going to tell their significant other where I'm going to meet them and the anesthesia. So we've already gone through that. So there's a lot of peace there. They know what to expect. For me, I've sat in my office with each and every one of their cases beforehand and I write out what I call a worksheet. And I still do this. It sounds like you would only do it if you're a resident, but to me it's a discipline because it makes me stop and review their history. And I write down little notes on the side about whether they thought one leg was longer or shorter, or if they were in braces as a kid because one hip was dislocated, or they injured their knee in college. I take notes just to jog my memory. And the X-rays, the plain X-rays that we get, are very important and very precise. We know their approximate magnification, about 15 or 20 degrees larger than real life. And we have what we call templates, which it's a clear plastic with an outline of the prosthetic that we anticipate using. And they're provided by the prosthetic manufacturers. And it allows us, within a size plus or minus, to come pretty close to know what we're going to use. But I can also see bone defects and what I'm going to have to do with bone cuts and what I need to build and what my ultimate plan is. I used to there's all sorts of software that I can do this with as well. I'm not using it right now. It was as good. In my experience, it wasn't better. It was taking longer. It wasn't being supported, but it's probably more the future. But the thought is that no, you go in almost knowing exactly what you're going to do. So as a result, there's no mixed signals with your staff. And you're not wasting time and money. Every time someone opens a tray in an operating room, and the trays can weigh anywhere from 10 to 25 pounds, and they're double wrapped with thick paper, and it's a big process, it's $100 every time the nurses open a tray. So, by going in very prepared and being very efficient, not I don't know whether I'm going to use this one or this one. No, you're very definitive. You've thought it through. No, you can change your mind midstream if you need to, but that's the rare, rare exception. Now, when I do partial knee replacements, I'll have the conversation with someone. Listen, this is my plan. This is what our studies show. Your symptoms are consistent with it. Your exam is appropriate for it. However, if in real life I open your knee, and the other compartments, those compartments which I don't plan on replacing, don't look healthy. No, you don't want me to do the wrong operation. And then I'll make a change. But that's probably twice a year.
But I see. So you already have it planned in case, the case, and you've discussed it with them and they know.
Well, a huge reason why I can do these incredibly complex cases, not the primaries, but some of these revisions, these wild cases, is because I've been there so long that it's like, your garage at home. After a while, you have all of your stuff. It's like anything. And, you've got your different bone grafts and you've got your different instrumentation systems and you've got if you break something, your different ways to fix it. And you need that particularly if you're going to be able to do those cases. And you need to have the wherewithal. And we're humans, and we set on a path to complete this goal, and we can become very focused and not see what's around us. But you can't do that. It's like landing an airplane. I'm a pilot, and when you're on final, you have to have the mindset that I'm going to land this airplane, but I'm prepared to go around. I'm prepared to make a change if something happens. This is the point in this procedure, in landing the airplane, that it's a no-go. And it's the same thing in the operating room. You have to know when to say, you know what? If I persist here trying to remove this stem, I'm revising a femur, and I'm going to remove a stem, and I don't want to break the femur in removing the stem. At some point, you may say, you know, I need to make a change here. I need to make a longer incision. I need to very gently lift the muscle. I need to expose the bone. It will be much better for my patient in a much more controlled environment and a much more predictable outcome if I open the bone in a controlled fashion versus hope it doesn't break. So it's a discipline, and it really only comes from having done this for now 26 years and made mistakes and said, I won't do that one again, I won't do that one again. And before you know it, you know, you're well into your career.
Okay, so when you do revisions, and we're not going to talk about any of the doctors who did the original operation, but in generic terms, did they not do what you've been doing? Is that why a revision is necessary? What is that?
You know, there's a lot of wonderful doctors, and I think we all do the very best we can. And sometimes the components don't go in just right, and either things are too long or things are too tight or things are dislocating or things aren't tight and they loosen. And sometimes things get infected. Even when you do everything right, it's the nature of the beast. And sometimes when you do everything right, something can fracture later on. Someone falls. And it's a whole different set of skills and instrumentation and know-how to now take something that's broken with something in it and repair it. And sometimes, like this horrible thing we're dealing with in the world now with the problems associated with metal articulation and these recalled hip stems with modular primary with modular necks and a titanium base implanted in the femur. These are just debacles. These have been just, we'll look back at this and say, goodness gracious, how did we ever step in this hole? But so to handle those and to end up with a really good result when you have to revise those, it's an art. And like any art, if you practice your art an awful lot more and you're really critical of yourself, you're always trying to improve your art, it's not perfect, but you have a much better chance of getting a better result, I think. I know.
Well, this is, there's a man that I've been trying to send to you, and he's not ready because he's in great pain. He's on medication, his hips, and maybe it's his knees, I think, yeah. He's not ready. And I finally said, when are you going to go? He said, well, I have a lot of friends, and they wound up in the hospital, and they had infections, and they did this, and they came out, they had an operation, and their knee still hurts, and I said, but look at Bill. He's not. I said, look, you always find stories. I'm sure you hear people like that. I mean, it's like I want to hit him on the head and say, come on, are you going to live on this medication? Excuse me. And then what's going to happen, I think, he's going to get his hips out because he's been leaning on his, with the knees, right?
So I think also recognizing that it's also important to go to a hospital that really does a lot of what your problem is, because if that's the case, there's teams that just deal with your problem, whether it's bariatric surgery, whether it's neurosurgery. At Holy Cross, we do a lot of orthopedics. That's why, we're truly, for a little community hospital, I just couldn't be more proud, but we have this U.S. News World Report really recognized national reputation. It always blows me away, and it always makes me feel so proud because of how many joints we do. So, the nurses on their orthopedic floor, there's a good energy and there's depth, and it's good. And it only comes from doing a lot. And then you can go online and you can say, well, what is this hospital's record? What is their infection rate? What's the percentage of people that bounce back in 30 days later? And these are appropriate questions. At the end of the day, you have to click with the doctor. But gosh, if it was me, would I want to walk through the hospital, or at least talk to people? Absolutely. You walk in and you just say, this is disorganized and it doesn't smell good. I'd walk right out. I'm just
I
as a
understand.
human being.
I'm glad you're saying these things.
I would be shopping.
So in other words, that's very interesting. So you may find the doctor, and then you find the doctors where the doctor performs the operation, and you should just go into the hospital, and they're not going to let you snoop around in the...
I think you could probably arrange, if you said, listen, I'm planning my surgery here, could I have a tour? I don't think that would be such a bad idea. And I think patients all the time will ask me, well, I'm only 30. Can I talk to someone else you've taken care of? Or I'm 90. I have a gentleman in the hospital now who's 90. He's 91. He's almost 91.
Great.
And I want to talk to someone who's my age, who you took care of.
And so you have a lot of people who, they all want to talk to people, don't they?
I just think, again, if it was me, and everything I do is if it was me, how would I want to be treated? I think it's very powerful to talk to someone who you can relate to, who's your contemporary. When I was applying to colleges and medical schools and residencies, again, some very wise person once told me that, if you go there and other people are happy, there's a pretty good chance that you're going to be happy. And if they're all really unhappy and angry, you need to pay attention to that gut feeling. So, we're dealing with people. At the end of the day, we're so technical and we're getting so scientific about what used to just be an art. But it's a people game.
Yeah, well, such good advice. I've been making notes on this whole thing now, and how you start out talking about noise, so much noise, and you don't, how do you separate the noise? And it's always wonderful to have you come here, because no matter how many times you've been on the radio, or you've been in our Cure Symposiums, I always learn so much from you. And you're one of the very few physicians, when you come to the Cure, you bring all this apparatus, and I look at these joints and things and say, oh, you're going to put that in me? I mean, it's scary when you think about it, but you make it, you show what you're going to do, and it's such a great thing that you really, you care a lot. I know that you're so sensitive about this.
Well, I take care of people, and I get so much back, and the more I get back, the more it fuels wanting to do better. It's how life works.
Yeah.
These people that are doing horrible things and they're estranged, somehow something went away. And if they could just get back into being constructive, it builds on itself.
Dr. Leone, as usual, it's wonderful. We're going to have you back again. We thank you so much. I think that people learned a lot this morning, and hopefully you will call Dr. Leone and give him a chance so that you can meet him also. Thank you again for being here with us.
It's my pleasure. Thank you.